Hello all, very good afternoon. I'm Dr. Vasundara Cheepurupalli, Senior Consultant Gynaecologist, Laparoscopic and Robotic Surgeon, KIMS Hospital, Secunderabad. So today we'll discuss about recurrent vaginal infections and recent advances in the treatment. So before going that, we have to understand what is vaginal discharge or vaginal infection, and what are all the risk factors, what is the basic treatment, and how to go ahead with the advanced procedures. So, as you know, the women body is, most of the women from head to toe are dependent on female hormones, like, which are being secreted with the ovary. So many of the parts like breast and all those parts are definitely have a stronger influence by the especially hormone like estrogen. So likewise, the vagina is also very much dependent on the cyclical hormonal therapy, cyclical hormonal changes, which happen routinely during menstrual cycles. So usually the menstruation and the menstrual period is divided into two halves, the first half and the second half. The first half is being predominant, we mostly dependent on estrogen, and the second part is by progesterone. So likewise, the vaginal discharges do change. So that is the reason we have to understand what is normal vaginal discharge first. So during ovulation, that is in the middle of the cycle, and during before menstruation, that is a day or sometimes even 4 or 5 days prior to our menstruation, we do have a lot of vaginal discharge. This is very much common. So if this vaginal discharge is very high, causing disturbances, then you have to consult a doctor to find out what could be the reason. Apart from this, if you have vaginal discharge, which is very high, causing your undergarment sweat, and the vaginal discharge causing you itching, irritation, burning sensation, sometimes even pain abdomen, painful intercourse, repeated urinary tract infections, all these could be because of the vaginal infections or recurrent vaginal infections. So before going for treatment, we have to identify the cause. As I said, this excessive vaginal discharges could be because of the hormonal changes or the pathological changes associated with the vagina and the cervix. Cervical lesions like cervical erosions or precancerous lesions, they do sometimes manifest in the form of excessive vaginal discharges. So cervical lesions and precancerous conditions, sometimes they may give symptoms like postcoital bleeding, intermenstrual spotting, and all those. So before that, we have to get ourselves evaluated with the proper speculum with our gynecologist and get treated accordingly. So the treatment also depends on the cause. So if our condition is because of the hormonal changes, we have to get treated with the hormonal therapy. If our condition is from the vaginal lesions, we have to get treated with the proper gynecological interventions if needed. And at the same time, the cause could be the most common cause for recurrent vaginal infections, getting repeated infections instead of medication, getting repeated medication and proper care could be because of both partners, wife and husband. So you have to evaluate whether sugars are all okay for you and for your wife partner, for your life partner as well. So if you are diabetic, and no matter how safely or neatly maintain your internal intimate part hygiene, or if your partner is diabetic, the chances of getting transmitted from him to you and from you to him are very high. Unless your sugar levels are controlled, the repeated infections and transmissions are very high from one partner to another partner. So in these cases, one partner will be acting as a carrier for longer time. So that is the reason you have to identify the cause for your repeated infections. Sometimes if you are immunosuppressive, sometimes if you are other conditions which may other treatments or other drugs which put you to an immunosuppressive state, then you may be having repeated uh, vaginal infection. Sometimes if you are on prolonged oral contraceptive pills, then repeated vaginal infections do happen. If you are on cancerous anti-cancer drugs, repeated infections do happen. So before going ahead for treatment, first you have to identify what is the cause and what is the factor which is putting you for repeated vaginal infections. You have to identify this. So when we come to the recent advances in this uh, repeated vaginal infections, we have to discuss about the basic treatment. Basic treatment, we usually treat both the partners simultaneously so that the carrier state can be prevented. So we examine the cervix and vagina, assess the systemic condition, and I try to identify the cause, try to identify the organisms or conditions which are putting ahead for repeated vaginal infection, then treat accordingly. And if we identify that, if we have having identified all these conditions, we usually go for the advanced treatments. The most recent advanced treatments for these repeated infections are if the cause is because of the cervical lesions, as I said earlier, cervical erosions are a precancerous condition. There are so many methods like cryocauterization or icing therapy, in which we freeze the cells. If we freeze the cells to a certain degree, so that all the cells uh, become become deeply frozen and then get lysed over a period of time. During this period, so this takes hardly 5 to 10 minutes procedure. So this is a daycare procedure in which no anesthesia is needed. Patient will be sent immediately 10 to 15 minutes after the procedure with the proper instructions, like to take care of her excessive vaginal discharges, which is expected after the procedure, and to have a higher amount of adequate hydration, and to have a proper intimate hygiene, and to avoid intercourse. These are all the preventive measures, so that patient will be having a comfortable post-procedure period, and which simultaneously can avoid the recurrence. The second procedure for these cervical lesions would be uh, cauterization, thermal ablation. In the thermal ablation is a procedure. We give a kind of higher temperature at a targeted preset preset temperature level. We try to the previous one is we freeze the cells. In this, we cauterize the cell. That means we put a heat to the cell and lies there itself. So this is a kind of a proven procedure wherein all the damaged cells get lysed there itself, and so that patient will be having a symptom-free period post-procedure. Even this has certain precautions and don'ts in the post-operative period, like to have an adequate hydration, not to have intercourse, and to have a proper intimate hygiene. So these two procedures have been giving a good results for our patients, because we have been doing this process for a longer time with a good results. I don't know how many of you know that these procedures are there for recurrent vaginal infections, which really can help in preventing the recurrence. These two procedures not only help in treating the cervical lesions, but also in some conditions where the reason is not identified for recurrent vaginal infection. Further, also we can try with these procedures. So what these two do for these patients is they they damage the glands of the cervix, next ectocervix, so that excessive secretions are decreased. And we come to some other procedures like recently developed practice procedures are PRP, that is platelet-rich plasma therapy, PRP therapy. In PRP, we take 20 to 25 ml of blood from the patient. We separate the platelet-rich plasma by a process of centrifugation. We inject the same PRP to the patient. That is with a small insulin syringe-like syringe, which has a very small needle, which is not at all a painful procedure. So what this PRP does is, we use the body's own fighting capacity and we inject this PRP at different levels, including the cervix, so that these nature cells from the patient's own body, they fight against the causative pathogens, like either it could be yeast, bacteria, or any other vaginosis conditions. So along with this PRP, sometimes 3 to 4 sittings of PRP would be sufficient for the patient. And sometimes even we combine this PRP with laser therapy. In laser therapy, we use the preset lasers and do a laser rejuvenation procedure. In this procedure, what this laser does is, it increases the vascularity of the vagina, which obviously increases the blood supply and helps in fighting against the causative organisms. So these organisms, like as I said, yeast or other microorganisms, these increased vessels, they fight against these and cause less frequency of recurrence. So over a period of time, the natural microorganisms of vagina invade, setting, and then the fighting capacity also increases simultaneously, and the pathogenic organisms come down. In these situations, so we use combination of therapies. Either we go for PRP alone, or we go for laser alone. Sometimes even we club the PRP plus laser. So these have been giving us a promising results. We have been trying this for almost 1 year, which we have achieved a good amount of success. So as I said, we have to identify the risk factors first. What could be the reason for recurrence? What are the risk factors of a patient which are causing recurrence? And then trying with the basic therapies like antibiotics or antifungal or other drugs, along with the normal saline or betadine dosings, and remove the load of the yeast or local causative organisms, and simultaneously treating with the prebiotics or the probiotics. That means these are the good pathogenic, good microorganisms which are naturally present in the vagina. They protect the vagina because nature has given us a normal inherent protective mechanism with providing our vagina with these kind of organisms. They fight with the pathogenic organisms. So whenever conditions we repeatedly washing our vagina with high pH unbalanced lotions, these microorganisms will go away and pathogenic organisms will invade. So that is the reason it is not advisable to go for any of these pH unbalanced lotions. So we treat simultaneously with the pre and probiotics, and then we prescribe to go ahead with either cryocauterization or thermal ablation or PRPs alone or laser alone, or a combination of PRPs and laser. The thing you need to understand here is 1 or 2 sittings of PRPs may not be useful, or laser may not be useful for treating this laser for these recurrent vaginal infections. Sometimes you may need to go for minimum of 4 to 5 sittings. By then, all your vagina will get its natural in you know will get back to its original integrity, with its original vascularity and with original fighting capacity. At the same time, this causative microorganisms will also come down. So I think I have explained you in a brief way what are all the causative organisms and what is the basic treatment and what are the advances. If you have any questions, I'm free to, I'm there to answer. Yes, I have a question to ask you about how can I differentiate a normal vaginal discharge and an infection? Yes, normal vaginal discharge usually happen. It happens during ovulation, as I said earlier. It is all hormonal dependent, and before menstruation, because of the hormonal changes happening in the vagina. If the excessive vaginal discharge is from infection, usually be getting uh, itching, irritation, foul smelling discharge, and a kind of uh, discharge which will be like curdy or very thick mucoid discharge, which is not a kind of normal one, which will be like a straw colored fluid. If you have any of these symptoms, definitely that could be because of infection. Are there any new medication or therapies for treating recurrent vaginal discharge? Yes, that's what I have elaborated till now. Yes, recent advances like PRP therapies and lasers, cryocauterization, or the freezing method, or the thermal ablation. These four are the recent advances, and they have been giving good result. Simultaneously, along with the recent whatever may be the treatment, you have to uh, identify the risk factors of your body, putting yourself for recurrent vaginal discharges, and treat simultaneously. In both, if you go in a in a both way, then the chances of recurrence come down very drastically. Are there any natural remedies or lifestyle changes that help manage recurrent vaginal discharges? Yes, definitely. Our lifestyle definitely helps in managing this recurrent vaginal discharges, because keeping ourselves, our personal, our intimate hygiene healthy will definitely put us in in a less risk for vaginal infections, and having a safer sexual practices will also definitely put us into a less risk for recurrent vaginal discharges. And other kind of lifestyle which I usually tell my patients that do not go for repeated vaginal washes with the over the counter medication. They decrease your natural immunity by decreasing your nature given organisms, microorganisms which are protective for our nature, vagina, and unnecessarily put us a risk for risk for invasion of the pathogenic organisms. That is the reason you should not go for unnecessary dosings on your own, unnecessary vaginal washes with the with the over the counter medication, unless it is prescribed. Can stress or hormonal changes contribute to? Yes, definitely. Contribute to recurrent vaginal discharges. Yes, definitely. Hormonal changes are the major causes for recurrent vaginal discharges. As I said, vagina is a completely hormonal dependent organ. Whenever the vascularity of the vagina comes down, it becomes a source of vaginal infection. The hormonal the changes definitely affect the vaginal integrity and vascularity, and stress definitely acts as a hormonal control. So that is the reason stress and hormonal changes definitely contribute to the recurrent vaginal discharges. How can one prevent recurrent vaginal discharge, and what role does diet play in managing recurrent vaginal discharges? Diet has a role in controlling your diabetes. Diet has a role in maintaining your lifestyle so that you can prevent recurrent vaginal discharges. What are the possible complications of untreated recurrent vaginal discharges? Yes. So if you are unfertile, if you are suffering with fertility issues, if you are newly married and uh, uh, not having children, the first condition we usually look at the vagina, and what are all the factors which are which are putting you into the infertile zone. So recurrent vaginal discharges and recurrent vaginal infections may cause may cause ascending infection and cause uterus and the fallopian tubules uh, infection, which may lead to the pelvic inflammatory disease, which may lead to the consequently may lead to the damage of the fallopian tubules. Ultimately, you may land up with infertility. So this is for infertile group. And second group is recurrent vaginal infections will definitely put you for recurrent urinary tract infections, because vagina and urethra are neighboring structures. Whenever you are harboring this pathogenic organism, they definitely take a track to the urethra and bladder. So you will be having recurrent urinary tract infections, recurrent pain abdomens, and at the same time, recurrent infections go through vagina and cervix and the tubes into the pelvic cavity, which can put you into the chronic PAD. So recurrent pelvic inflammatory diseases, which can cause recurrent pain abdomens. In either way, you will be suffering with severe pain abdomen, not getting relieved with any of the painkillers, not getting relieved with any of the basic treatment. You will be having, you will be falling into these kind of danger zones. How does just now I have answered this question. How does recurrent vaginal discharge affect fertility? I have answered this question just now. Can recurrent vaginal discharge affect sexual health? Yes, definitely. As I said, this is the sexually transmitted diseases many a time. So other partner can act as a carrier, and will be transmitting disease from one partner to another person, one person to another person. At the same time, so recurrent vaginal infections will put you into a state of severe PID, which can cause severe pain during intercourse. That means dyspareunia. So in this way, this can affect the sexual health. What are the most common misconception about recurrent vaginal discharge? The most common misconception about recurrent vaginal discharge is, so patients think that that getting treated once, once would be sufficient for lifetime, and no need for the partner to be treated. This is the most common misconception, because when we advise the medication for the both partners at the same time. Many a times we come with the answer that my partner is not ready to take up the medication because he is not cooperative and he is not willing to take the medication, saying that he's all healthy and good, there is no need for him to take medication. And this is the most common misconception. As I said, it is a transmitted, sexually transmitted, or a kind of harboring disease. That is the reason both the partners should be treated simultaneously. What important research findings or advancements have been made in treatment of recurrent vaginal discharge? Uh, I have explained this already, saying that uh, lasers, PRP treatments, thermal ablations, cryocauterizations are the recent advances which have been giving us promising results. How long does it typically take to see improvement with treatment of recurrent vaginal discharge? So it all depends on how we control our health and how we identify our risk factors which are putting us for recurrent, for these recurrent vaginal infections, and at the same time how compliant you are to that therapy. So this is the most important factors. So many questions are shooting up. How long, yeah, to see how long does it typically take to see improvement with treatment? Minimum to minimum 4 to 5 weeks. You should wait for the therapy to come out. Sometimes we may have to repeat the therapy, or this PRPs or lasers for 4 to 5 cycles. You may have to be patient for minimum of 2 to 3 months. This, what are the common causes of recurrent? This have I have already answered. I think that's it. Thank you so much.